Hi, I'm Tom Flaim, physician at Certified Allergy and Asthma Consultants here in Albany, New York, and our topic today will be penicillin allergy. Well, let's start with a few statistics. About 10% of the population has a history of penicillin allergy. About 15% of hospitalized patients have a history of penicillin allergy. It turns out, though, that when you skin test patients with this story, 90% are negative. That is, they don't have penicillin allergy. As an allergist, the story is very important to us. So two of the things we pay most attention to is timing and then the type of symptoms that you experience. Timing, if you have an allergic reaction, can start within minutes, maybe an hour or two. Beyond that, it makes it unlikely that it's an allergic reaction. The type of symptoms we're looking for, well, there are going to be lots and lots of symptoms that you can potentially experience with an allergic reaction. The more common symptoms are going to be hives, swelling of your eyes, your lips, difficulty breathing. You can have vomiting. You can, in more severe cases, your blood pressure can drop. Now, even if your story sounds like you have allergy, the good news is that 80% of patients with true penicillin allergy outgrow their penicillin allergy within 10 years. Once we've gathered our history and our exam, we then proceed to do skin testing. So the testing is broken up into three parts. The first part is we place drops of the different penicillin proteins on your forearm. The nurse does a little bit of a scratch. We wait 15 minutes and we look for a red itchy spot. If that's negative, then we take more of that allergen, put it in a small needle, inject a little bit underneath your skin in the upper part of your arm. We again wait 15 minutes and read it. Now, if that too is negative, we're 98% sure that you're not allergic to penicillin. We don't like 98%. We like 100%. So the third part of the test is we actually give you amoxicillin in the office and we watch you for an hour, and if there's no reaction, you're not allergic to penicillin anymore. So is penicillin testing safe? Well, there have been no reported cases of fatalities with this skin testing that we just described. When you're challenged with amoxicillin, maybe 2 to 3% of patients will have a mild allergic reaction, but that's about it, and it's easily treated. Okay, so there are patients that we won't skin test because the skin test won't help us. So again, we go back to the history. So if you have a history of a severe skin reaction where there's blistering or peeling of the skin, high fevers, and particularly if it involves the mucosal membranes like your eyes, your nose, or your mouth, those are different types of reactions. We're not going to pick those up with our skin testing. If you have that story, oftentimes patients with this story are hospitalized. These are very severe reactions. There's no point in doing skin testing. You can't have penicillin. The other type of patients that we don't skin test are patients with other side effects of penicillin. So some patients may experience a drop in their white blood cell count or their red blood cell count, have anemia. There are patients who can have liver or kidney damage, and again, those are not allergic reactions. Skin testing is not helpful. There are other patients that have milder reactions. We call them serum sickness reactions, where you can feel kind of crummy, feel achy and so forth, maybe a low-grade fever. You might have joint swelling with this reaction. Those two are not allergic reactions. You shouldn't take penicillin with that story, but skin testing is not going to be helpful in those cases. Another situation where we don't skin test is if we don't think you have allergy. So if you have isolated diarrhea, for example, after taking an antibiotic, that's very unlikely to be an allergic reaction. You can take penicillin in those situations. Or if you have a family history of penicillin allergy, your mom and dad told you, don't let anybody ever give you penicillin. Well, I have a little secret for you. Your parents are wrong. You can't inherit penicillin allergy. So with that story, we don't need to test you. You can have penicillins. Some of the reasons you don't want to use broad-spectrum antibiotics are you may develop resistant bacteria in your system. You can have kidney damage with some of these antibiotics. The likelihood that you're going to be readmitted for the same infection is also increased with use of these antibiotics. and you may develop other complicating infections, particularly of your gastrointestinal tract, with use of these antibiotics. So if you think you have penicillin allergy, or you've been told that you have penicillin allergy, the point is it's very unlikely that you actually had penicillin allergy, or even if you did have it, it's likely that you've outgrown it. So my suggestion is to make an appointment and get evaluated for it, and hopefully we can take that diagnosis off your chart.